Cervical spondylosis is a common degenerative condition affecting the cervical spine, especially as we age. It can lead to symptoms like neck pain, myelopathy, and radiculopathy, impacting daily life and mobility. Traditionally, the gold standard for surgical treatment has been anterior cervical discectomy and fusion, or ACDF. While ACDF is effective, it comes with its own set of complications such as pseudarthrosis and adjacent segment disease, which can limit motion and sometimes require additional surgeries. As our population ages, the prevalence of cervical spondylosis increases, making it crucial to explore new treatment options that can address these limitations. This set the stage for innovations like cervical disc arthroplasty, which aim to preserve motion and reduce complication. Let's take a closer look at how these treatments compare and what makes CDA a promising alternative. Anterior cervical discectomy and fusion, or ACDF, has long been the go-to procedure for treating cervical spine issues. Developed in the late 1950s, ACDF allows for decompression and stabilization of affected segments. However, fusion can lead to loss of cervical motion and complications like pseudarthrosis and adjacent segment disease. Over time, the need to preserve motion and reduce these risks led to the development of cervical disc arthroplasty, or CDA. CDA replaces the damaged disc with an artificial one, maintaining mobility and potentially lowering the risk of adjacent segment degeneration. The evolution of implant designs, from early ball and socket models to modern physiologic prostheses, reflects ongoing efforts to mimic natural spine movement and improve patient outcomes. As we move forward, it's important to understand the biomechanical principles behind these devices and how they impact long-term results. Cervical spine is a remarkably mobile structure, capable of movement along multiple axes. When designing artificial discs, engineers must consider the unique biomechanics of each vertebral segment. CDA devices vary in their degree of constraint, from constrained to unconstrained, affecting how closely they replicate natural motion. Some designs allow for translation and compression, while others focus on uniaxial movement. Position and type of implant can influence the axis of rotation and overall range of motion after surgery. These biomechanical factors are critical, as mismatches can lead to stress on the implant or surrounding tissues, potentially limiting motion or causing complications. Modern CDA implants strive to balance stability with mobility, aiming to restore function while minimizing risks. Understanding these principles helps surgeons select the right device for each patient, optimizing outcomes and long-term durability. Multiple high-quality studies have compared CDA and ACDF, showing that CDA often matches or exceeds ACDF in terms of success rates, especially over the long term. Patients who undergo CDA tend to have lower rates of adjacent segment disease and fewer reoperations at both the treated and adjacent levels. However, CDA is not without its unique challenges. Heterotopic ossification, or HO, is a complication where abnormal bone forms around the implant, potentially limiting motion and causing pain. While mild HO may not impact outcomes, severe cases can mimic the effects of fusion. Implant migration is another rare but serious risk, emphasizing the importance of surgical technique and device selection. Despite these concerns, the overall trajectory for CDA is positive, with robust evidence supporting its use in appropriately selected patients. As technology advances, CDA may continue to redefine the standard of care for cervical spine disease. Cervical disc arthroplasty represents a significant advancement in the treatment of degenerative cervical spine conditions. With over 20 years of follow-up data, CDA has proven to be a durable and effective alternative to traditional fusion, especially for patients without severe facet arthropathy. Ongoing improvements in implant materials, biomechanics, and minimally invasive techniques are likely to further enhance outcomes and reduce complications. While ACDF still has a role in certain cases, the growing body of evidence suggests that CDA may soon become the new gold standard for many patients. As research continues and technology evolves, patients and surgeons alike can look forward to even better solutions for preserving motion and improving quality of life in cervical spine care.